Hey there, Christophe from the French Herbal. Okay, this is home. I was born about 10 miles from here. We are in the southeast of France, the Provence region, and this is the end of the summer. We had a very hot, dry spell and the plants are suffering. This is the land of resinous shrubs, of pines, of holly oaks, junipers, and very, very strong and aromatic plants. And you see, today I'm really excited to talk to you about a big native aromatic remedy, one that is seriously underrated, even though it's actually very powerful. It's the plant I use the most throughout the winter. In Provence, we call it la farigoule. Let me introduce you to thyme, of course. Stay with me, we're going to take a deep dive into this remarkable medicinal plant and its many properties, much appreciated in French herbalism, and you'll see just how useful it can be. I will quote some very well-known and experienced French herbal doctors to show you just how much reputation this little guy carries. I will share with you my clinical experience as well. So this episode will not be a short one, which is good because I don't want to take shortcuts. And by the way, a lot more is coming on this channel and I will only do deep dives. So if you don't want to miss future episodes, well, you know where to click. Okay, before we start, you should know that I'm not a doctor, I'm not a pharmacist, I'm not a healthcare professional, and this episode is not a substitute for medical advice. Always consult a qualified healthcare provider before using herbal remedies, especially if you have a medical condition. Okay, that being said, let me start with a story. A few years ago, a client of mine called me. She was undergoing chemotherapy and was completely exhausted and depleted by the cancer and by the treatment. She was in between two chemos, so we didn't have to worry about plant-drug interactions. Her weakness was the urinary tract. You know, she was getting recurring cystitis. Every 2 to 3 months, she would get a new infection, and this always ended up with antibiotics. Her immunity, her gut flora, her vaginal flora were obviously damaged. So, you know, she called me to make an appointment to start the long-term work, and I had not seen her yet, but a new UTI was starting, and she asked for my help. So I asked her what she had in her cupboards in terms of plants. Well, nothing. But she lived around here in Provence and she knew where to find wild thyme. So I told her to gather some and drink the tea. So she asked me, how many cups? Many. One every couple of hours. At the end of the day, you will have consumed probably 6, 7 cups. How much thyme per cup? Enough to make the tea strong tasting, strongly aromatic, but still drinkable. And I told her to go see a doctor if the situation got worse or if the situation did not improve in 48 hours. And 2 days later, no sign of infection. Gone. So that is thyme, folks. Immune stimulant, hot, circulatory, major antibacterial, antiviral, antifungal with affinities for the gut, the lungs, and the urinary tract. Shall we get into the details now? I think so. So the plant, we call it common thyme or just thyme, Thymus vulgaris. It belongs to the Lamiaceae, that big family of aromatic plants that includes rosemary, savory, lavender, oregano, lemon balm, mint, and much more. Thyme is a small perennial shrub with tiny gray-green leaves, and as the plant ages, it gets woodier, which is perfectly normal. And if you grow it in your garden, you'll learn to prune it to encourage fresh growth and keep it from becoming too woody. But be careful as well. If you cut it back too aggressively, you can weaken the plant and it might not grow back. We harvest the leaves and the tiny flowering tops, ideally at the beginning of the flowering period. Here I'm going to show you some thyme at the end of August, so it's very dry. The flowering tops are, gray, so it's way past the flowering period. Most of the time when we pick the leaves of medicinal plants, particularly the aromatic ones, we wait for the beginning of the flowering period because it's a time when the plant maximizes production of constituents in the aerial parts. But honestly, I also pick thyme whenever I need it, year round. You know, it's such a useful plant. If you have it in your garden, I'd rather pick it fresh outside of the ideal period than to use my older dry stock. Now, don't pick just after a rain or the plant won't be as strong. Pick during dry periods and pick early in the morning just after evaporation of the morning dew. Now, we're really after the leaves with the flowering tops, ideally not the older, thicker, woody stems. If the stems are fresh and tender, no problem, keep them in your preparation. If they're tough and woody, try to remove them or you'll end up with a very coarse, like tonic tasting preparation that kind of gets stuck at the back of your throat in terms of taste. If you want to build some stock of the dried plants, the easiest way to harvest this is to grab a bunch of branches, cut at about 2/3 of the branch, leaving 1/3 on the plant. Then you lay them flat on a rack to dry, or much better, you can put them all in a big paper bag. You know, they have to be loose in the bag and you need to be able to turn them during the drying process. As you turn them, the leaves will detach and end up at the bottom of the big bag. You know, that's it. That's where you go get your tiny dried leaves, at the bottom of the bag. Then you store it in a cool, dry place, in a paper bag, and they keep for at least a year when the plant is very aromatic, sometimes more, sometimes a little less. You have to check them out. Now, one of the big questions everyone asks is garden thyme as strong as wild thyme? And the answer is a definite no. If you came to see the thyme in my hills in Provence, you'd find it growing in extremely dry, sunny spots, you know, sometimes from a tiny crack in the rock with barely a pinch of soil. And that thyme struggles to survive, and it's incredibly potent. You know, like grapes to make good wine, aromatic plants, they need to struggle a bit to bring out the best in terms of essential oils. The chemotype tends toward the phenols in my region, thymol and carvacrol. Now, for those of you American herbalists, the closest wild plant that I met in the US that had a similar chemotype was wild Monarda fistulosa, growing in very hot places with poor soil in the southwest US. Okay, so please note that I'm not going to talk about thyme essential oil in this episode because if the essential oil has a phenol chemotype, it's very strong and aggressive, and it comes with precautions. And we have different thyme chemotypes in French aromatherapy, and they're almost all like different remedies, right? So let's keep that out of this discussion. For this episode, we're just talking about the whole non-distilled parts. So yes, wild thyme in my hills, super strong, but don't let that discourage you from growing thyme in your garden. You know, in my experience, garden thyme may be less potent, sure, but it's still incredibly useful. So grow thyme in your garden, full sun, well-drained soil, add a little sand if your soil is clay heavy. If you can, plant the thyme against a south-facing wall and surround it with stones to store the heat. You know, thyme loves that. And it does require a lot of sun to give its best. The only problem with thyme is that it's considered a cooking herb. And we had an 18th century medical professor who was teaching in Paris. His name was Bernard Péril, and he said, thyme is a very active plant, less used in medicine than it should be, probably because the idea of a condiment excludes that of a medicine. In other words, if it tastes good in your plate, it can't possibly be good medicine, which is of course completely wrong. When you drink thyme tea or when you chew a few leaves, what comes through is its warmth and its stimulant effect. You know, it's like it has stored up all that summer sunshine and giving it back to you. The energetics of thyme, clearly warming and drying. In terms of constituents, we can find an essential oil with a chemotype that will vary a lot with the location, with the weather, with several parameters. As I said, here in my place, you can feel the phenols. In other places in the world, it might be linalool or other constituents, but let's simplify. We're not dealing with the essential oil today, but just with the traditional preparations like tea or tincture. It contains flavonoids, making it antioxidant and anti-inflammatory. It contains phenolic acids like chlorogenic, caffeic acid, making it antioxidant, anti-inflammatory, antimicrobial. It contains a fair amount of tannins, so it will have some astringent effect, especially if you use some older branches and especially if you let it infuse for a long time. So if you just want the aromatics, you infuse it for a short time, like a couple of minutes, 2 to 3 minutes. It has some triterpenes that modulate immunity and protect the liver, and on it goes. Very, very complex plant. Let's talk about its properties and indications now. Its oldest and most famous use is for fighting off colds. You know, when you feel that first chill that tells you that an infection is coming, thyme is your best friend. Very simple to use, several cups of thyme tea throughout the day. It's a major protector of the lower respiratory tract, the lungs. It will protect against any type of respiratory infection, upper or lower, but it does have an added strong affinity for the lungs. Great combination is ginger root, fresh and grated, 1 small teaspoon, plus a few sprigs of thyme if fresh, or a teaspoon of the dry leaves or more, depending on the quality of your thyme. Add a bit of lemon juice once the tea has cooled down a bit, and maybe some honey. It's delicious and it's quite effective as a winter drink. If the cold turns into bronchitis, keep going with thyme and even go stronger. The aromatic compounds from the tea will be absorbed in the gut. They enter the bloodstream in general circulation, and they're excreted into the lungs, where they help you fight off bacteria and viruses. Also, it thins the mucus. It makes it more liquid, less thick and pasty, and it helps with expectoration. And here we use the term mucolytic and expectorant. And this is especially useful toward the end of a bronchitis, when the person is, you know, kind of tired of coughing so much. The mucus is thickening, the lungs are tired, the person is not being able to expel the mucus very well, and it's making the person at risk of relapse. So here we need to liquefy and expectorate. Drink it regularly throughout the day, not just 2 cups, you know, 1 in the morning, 1 in the evening. You make a full liter, you sip it often. Another great combo here, especially for the lungs, is thyme plus licorice root. In your thyme tea, you can add, I don't know, 1/3 of a teaspoon of licorice root powder, for instance, if you don't have contraindication for licorice. Licorice supports the immune system. It modulates inflammation in the bronchial tubes, and it helps with expectoration as well, with the moistening energetics. And as always, if your condition does not improve, just go see your doctor. It will have a stimulant effect on immunity. Jean Valnet, one of our deceased great herbal docs, said that it stimulates the making of leukocytes, of white blood cells, during an infectious disease. Now I'd like to go back to coughing for a second, because we need to be precise here. You see, you might think that thyme is a bit of an irritant, and that it's how it kicks the lung into action, you know, making it produce more mucus because it irritates it a bit, but it's actually more subtle than that. Thyme is a cough regulator. It stimulates mucus production and coughing when needed, meaning when the cough is productive, when there's mucus to expectorate. But it also helps contain the cough reflex when you have a dry cough. You know, it could be the dry, irritative cough of kids. It could be the inflammatory cough caused by allergies. And you see, it's actually a strong antispasmodic that seems to act on the cough reflex itself, which is kind of a spasm when you think about it. And thyme was often used to relieve whooping cough in France, which is very spasmodic in nature. And let's take an even further step back. Here in France, thyme is positioned as an antispasmodic of the overall respiratory tract. And do you know other type of spasms in that system? If you think asthma, you're correct. It was used for asthma. In the past, it was used for emphysema as well here in France, and still is today. So thyme as a balancer of lung function. You know, we could think of great lung tonic herbal mixes containing thyme, maybe mullein flowers, bit of licorice, elecampane maybe. One last indication from Éric Laurent, a French herbal doctor. He says thyme to calm the inflammation of the respiratory mucosa provoked by inhalation of bleach fumes. That one is interesting. And I will finish this section on thyme and the respiratory tract with my own story. About 15 years ago, I caught a major bronchitis. I was exhausted. I did not take care of myself very well. You know, sure, I used herbal remedies here and there, but not often enough, not strong enough, not consistent enough. I forgot to take them every couple of hours. And yeah, I was busy, I was running around, and well, you know, I was trying to make a living out of my herbal activities and was pretty darn stressed. And bam, you know, the viral bronchitis turned into a bacterial bronchitis. I had fever, I had trouble breathing. So I had a course of strong antibiotics and cortisone. I got better. And then a week later, I started to feel worse again. So at this point, I lined up my best remedies. I had thyme for my teas. I had propolis tincture to add to my tea. I was growing Grindelia back then. I had a very strong Grindelia tincture. I was growing hyssop. And so my base was a tea blend, thyme plus hyssop, and then I added about 20 drop propolis tincture, 20 drops Grindelia tincture, 1 cup every 2 hours ad nauseum. And I swear I could not stand the smell of thyme after a few days, but I got rid of that nasty infection. Then for about 5 years, every winter, if I didn't drink my thyme tea, I would start to get lung inflammation and a productive cough. And actually, astragalus was also a big savior as a lung protector. Because you see, my lungs had been severely damaged, probably scarred and weakened by this bronchitis. So for 5 years, I had to be very careful. I could not let my guard down, but thanks to thyme and astragalus, I could avoid any further lung problems. Okay, next indication. As I explained in my little story at the beginning of the episode, very useful in any type of UTI, of urinary tract infection. Now be careful that this does not evolve into a kidney infection, you know, what we call pyelonephritis. So don't wait too long. Go see a doctor if things do not improve. And here again, frequency and dosage will make all the difference. When we put a program in place, if the condition is very acute, it's got to be high frequency with good and strong preparation. And when you have a UTI, it's good to drink a lot of fluids. So here, forget about the tincture. The tea form, you know, what we call infusion in France. That will be the most appropriate form. We'll talk about tincture and other forms in a minute. Éric Laurent mentions that thyme will work on E. coli even if the strain of E. coli is resistant to antibiotics. You know, if your UTI seems to be antibiotic resistant, think of thyme, think of juniper, and that information we got it from the great Stephen Buhner. Think of propolis as well. a thyme infusion with some added juniper and propolis tincture, that would be a very good idea. Now, good combinations for UTI: thyme plus heather. We'll talk about heather in another episode. And more generally, a lot of plants in the Ericaceae family will help, like bearberry leaves. Good combination as well with diuretic plants like goldenrod. Hibiscus is quite good as well here, etc., etc. I will present all of those plants in future episodes. Okay, the last organ system, if you remember in my introduction, I said respiratory tract, urinary tract, and digestive tract. Thyme is a reliable herb for bloating and cramps as a simple digestive tea, while also balancing the gut flora. It will have a cleanup effect on pathogenic strains in the gut flora. Useful for oral or intestinal candida, useful for traveler's diarrhea and more. If you look for an antibacterial or antifungal for a lingering gut infection, maybe you've been to Peru and Chile and Bolivia like I did a few years ago, and you did not come back home alone. There were some new hosts in your digestive tract. Well, thyme will be of use until things improve, maybe with walnut leaves, maybe with a bit of berberis root bark, etc. Since it's such a major disinfectant, thanks to its aromatic, it can be used for gingivitis, for periodontitis, whenever there are pockets of infection in the mouth causing inflammation, and then you do a mouth rinse with the concentrated tea. The last major use I'd like to mention is as a tonic. And in a future episode, I will explain what type of tonics we have traditionally used over here in France. I will also define that term, tonic, because it's not well understood. I will mention several categories of plants that have a clear tonic action. We have the purely bitter tonics. We have the hot aromatic tonics in the Lamiaceae. We have the aromatic bitter tonics from the roots of certain Apiaceae, and we have aromatic bitters from certain Asteraceae. If this sounds pretty cryptic, I know, don't worry about it. I will spend a lot of time explaining all of this in a future episode dedicated to tonics. For now, let's just say that thyme was used when the person was going through periods of serious fatigue. And in the past, this type of fatigue was due to long or severe illnesses. Today, we can use those tonics for chronic fatigue states, for burnout states, and here the physical fatigue leading inexorably to also mental fatigue, loss of motivation, and if it continues, depression. Thyme, just like other hot aromatic Lamiaceae like rosemary, savory, or oregano, has a reputation of kicking the whole machine into higher gear. Now, don't expect quick results, this is not caffeine, but integrated into a program for chronic fatigue states, long-term use, small doses, thyme can help. I will quote Henri Leclerc, one of our great French herbal doctors. He said, "Thyme acts on the circulation and on the nerve centers in a way that manifests as a greater pulse amplitude, works on the heart, increased physical strength, and improved morale." Not too bad for such a common little plant. Quickly, some other uses for sore throats. Thyme's tannins will tighten the swollen tissues and will disinfect, but honestly, sage works even better here. So my preference goes to sage for sore throats, although thyme is definitely great as well. Thyme for wound care, a strong thyme tea or a thyme tincture is highly antibacterial and disinfectant. You dilute 1 part tincture in 3 to 4 parts water you apply to the wound. I sometimes carry a small bottle of strong thyme tincture on hikes in my backpack. And as a morning cup, Jean Valnet said that a cup of thyme tea in the morning will replace coffee or tea as a morning tonic. Now, in terms of preparations, the tea, what we call infusion in France, it works great. 1 teaspoon of the dried leaves per cup, adjusting for flavor and intensity. It's got to be fairly strong in taste, but still drinkable. And quality varies greatly. Make sure your thyme is aromatic and adjust the quantity per cup as needed. The tincture, for fresh thyme, I use pure alcohol, 200 milliliter alcohol for 100 grams of fresh leaves. For dried thyme, I use 50% alcohol, 500 milliliter of alcohol per 100 gram of dried leaves. These are the Michael Moore ratios. I didn't change them. You macerate for 2 weeks, you shake daily, you strain, and then about 20 drops is plenty for a wild thyme tincture. If it's garden thyme, probably more like 30 to 40 drops, repeated several times a day if necessary. You can make a very strong syrup. First of all, you make a strong thyme tea, then you sweeten with honey. That will be very useful for winter infection. We'll talk about syrup preparations another time. In terms of contraindication and precautions, we're talking about traditional herbal remedies here, folks, not the thyme essential oil, I remind you, which has its own safety rules. So, for traditional preparation, contraindicated during pregnancy or breastfeeding due to lack of data. And here you may ask, what about the fact that I added some thyme to my vegetable stew? Or what about that blend in the tea bag I drank the other night at some friend's place? You know, it had a little bit of thyme in it. That should be considered as safe. And I know, sorry, but today we cannot draw a clear line between what would constitute a condiment and a herbal remedy. That's the way it is. Caution if gastric or duodenal ulcer or gastritis, because a concentrated thyme preparation could temporarily aggravate the symptoms. Some people who handle thyme daily, like pickers and growers, can develop skin or respiratory allergies. We have one animal study that suggests high doses of thyme extract could reduce thyroid activity, but the doses were not realistic, and there's no evidence of this in human at the doses we usually take. Some sensitive people could have some digestive upset and a bit of nausea if the thyme preparation is a little too strong and concentrated. And overall, if you use a strong thyme preparation, do it for the short term. If you wanted to use it in the long term, lower the doses and integrate it into a blend. It will be much better tolerated. So here you have it, folks. Thymus vulgaris, common thyme, common, yes, very common in the gardens, in nature around here, but what a useful plant. Personally, I couldn't get through a winter without thyme. If you like this video, please subscribe to my channel and share it with anyone who might be interested. And I'll see you soon for another episode of The French Herbal.